According to the cases reported in the literature, the information provided by the CDC, and based on my own experiences with several patients at our local hospitals in San Antonio, patients with e-cigarette associated respiratory illnesses usually present with shortness of breath, cough, which is most commonly non-productive, and/or pleuritic chest pain. These symptoms usually occur over several days to a few weeks before hospitalization. Systemic findings might include tachycardia, fever, chills, night sweats, and/or fatigue. Some patients initially presented with gastrointestinal or GI symptoms, such as nausea and vomiting, significant abdominal pain, and/or diarrhea. But what's most concerning to me is that these GI and systemic symptoms often preceded the respiratory symptoms or findings, in some cases by up to 2 weeks. In addition, up to 75% of the affected patients who ultimately required hospitalization for an e-cigarette associated respiratory disease initially presented to what we call frontline clinicians, such as those in a primary care clinic or an emergency department, and they were sent home due to nonspecific signs and symptoms which mimic common viral illnesses. Therefore, it's critical for all healthcare professionals to have a high clinical suspicion for e-cigarette associated respiratory disease, particularly while more information is being gathered. When suspected, the CDC recommends asking patients about specific substances inhaled, the manufacturer, where the products and/or cartridges were obtained, the type or types of devices used, and the methods used, such as aerosolization, dabbing, or dripping.